definitely. One procedure in Indiana, I was quoted as $50,000. That's why I decided to come here.
Thousands of Americans are flying to Mexico for dental implants. But is it actually safe? Is the quality real? And what happens if something goes wrong after you're already back home?
I've saved probably.
In this video, we have real patients, real doctors, real numbers. Everything you need to know before you decide.
Before we do anything about an implant, we have to decide if you're a good candidate for an implant.
Who is a good candidate for an implant?
People that don't have any bone loss, non-diabetic, people with good overall health. Before we decide that, we'll do some blood work, and once the lab results come back, we'll go ahead and try to schedule an appointment for the surgery.
70% of bone, a good bone level, acceptable for doing 3-on-6 option. For those patients that level of bone is around 50% or less, I always recommend all-on-4, all-on-6, because the position of bone, it gives us a different position of implants.
There's 600 brands of implants in the market nowadays, but we use the brands that are FDA approved and that are very common in the US and Canada, because most of our patients are from there. So if they need to see something to be done in the US, it's an implant that's always available in the US, and that's important for us because of our dental tourism patients.
I had nothing but them on paper, and sometimes things can look good on paper, but they don't look great in person.
Implants is very strange, has a big problems. Obviously, the most common is infections. It happens, it's true, but it's not very common.
When I have patients with issues of bleeding or an open stitch, like common things, we always can have an interview by Zoom or WhatsApp or whatever applications they want to use to get a contact with us. We can show them how to stop the bleeding or what they can do, or if it's an emergency, so they can come to our clinic, or if they need to see another medical that is not a dentist. It's not very common these things to happen, but we always prepare, and my assistants are prepared to answer that kind of problems.
Titanium is a material that adds directly to your bone. Most of our patients request the titanium implant. It's price, first of all, and also its durability. There are other patients that request zirconia implants because they don't want to have metal in their body at all. We only had one patient that was going through radiation, and it's pretty understandable why that specific person did not want to have metal in the body. But otherwise, I will see that it's a preference more than another thing.
For dental implants, commonly our specialist requires about 3 visits. For example, the first visit is just a one-day visit. It's just for the clinical checkup, x-rays, diagnosis, planning. If you are a candidate, they can actually place the implants on that same day.
Planned the whole week off, so I went there on a Monday, and I think we did the surgery on Wednesday, and Friday I went home.
We do what's called a guided surgery. So basically it's more accurate surgery.
That they did, they fitted and let's see if it fits. And then they did the adjustments, and then they were like, okay, have a seat for 30 minutes, it'll be right back. I'm like, what? 30 minutes? It was like, what kind of magic is this? I looked them up and found out that they were American Dental Association certified. I put their office's name in the Better Business Bureau's website. I wasn't fearful in the fact that I knew their reputation before I made any appointments with them.
Even with travel expenses and my husband coming, it's still way cheaper than it would have been to have it done in the United States. We have a hotel in Yuma, and we just come here in the morning. There's a nice parking lot. I think they charge $5 or $6 to park. So you just leave your vehicle there. A lot of people actually camp in the area and just come over that way. You just cross the border and you might be asked a few questions.
I parked on the border and then walked across. First 2 nights I stayed in a motel in the States, and then Sani put me up the rest of the time, right above the dentist's office. They had a hotel up there. Very clean, very nice.
We've had very little problem getting over the border. In fact, no problem. Everybody's very pleasant. There's always transportation available.
You don't have to always go somewhere and get something done the first day. You can go over and check them out and talk to them and ask to see the office or whatever. And if you like it, get the work done. The total cost just for the implant was going to be like $20,000. And I'm like, that's just one tooth.
Because I had all new implants put in, so it was a lot cheaper there than it was in the States.
I've saved probably $40,000 based on I've been here 4 times and all the work that I've had done.
Without doubt, price-wise, here we charge half or less than half than what they charge in the US. So that's a big, big thing. At least 50%, if not up to 75 sometimes.
When I got there, their office was actually better than the dentist's offices that I had gone to in the US.
The reason is I told a lot with the patients, and all the patients say the same. The reason is the quality.
It was good to get back to eating good food again, bakes and corn on the cob. And before I was always eating softer foods just because, my teeth hurt and, couldn't chew hard stuff. And now I'm all back to normal.
I'm happy with it. The teeth fit. They're finally back to the normal length instead of the worn down, ugly teeth I've had for so many years.
Don't wait. Tell them to get it done.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.